Dear students, today we are going to have a lecture on osteoporosis. In the introduction, if we say osteoporosis is a disease for the skeletal structure. Now, in the osteoporosis, more females are prone to develop the washout of the calcium and phosphorus from the bone compared to males. So the ratio is 4:2, which means at every 4 males, one male will be affected with osteoporosis, as well as every 2 females, one female will be affected with osteoporosis. Affection meaning here is that they are prone to develop osteoporosis. Osteoporosis is responsible for the fractures. Now we all know that because of the osteoporosis, bone becomes brittle, and due to that, the segment on which there are torsion forces or stress, strain, due to that they are very prone to develop the fractures. It is also called as a silent disease, as we do not know, because we do not have any sensation related to the osteoporosis, and that's why eventually it grows without our knowledge. It is a commonest metabolic bone disease, just like obesity. Okay. Now, it is characterized by diffused reduction in bone density due to decreased in the bone mass. So, as we all know, there is a bone formation, simultaneously there is a bone resorption. If there is an imbalance between the bone formation and resorption, which means the resorption gets higher compared to the formation, which means compared to the deposit of the calcium and phosphorus, if the washout of those two minerals gets higher, then that means the bone becomes brittle. It occurs when the rate of bone resorption exceeds the rate of bone formation. Consider this as a definition. It's a disease of bone that leads to decreased mineral content and weakening of the bone, right? On my left side to your screen, under the normal bone legend, the image shows that the porosity of bone is really less. All the pores are the kind of holes. Pores of the bones are overlapping to each other. That is one of the net formation that naturally occurs in bone, if we see it microscopically. On the other side to your right, under the osteoporosis legend, as you can see, the diameter of the pores is increased. The density of the calcium and phosphorus deposits is less due to more porosity. Porosity meaning more uh, more holes inside the, or more cavities inside the bones as compared to the structure deposit. Now if we see which joints are actually prone to develop the injury, which structures in the skeletal system are more prone to develop the damage, or I would say injury, in terms of fractures. So the highest fractures occurs in the spine, followed by small joints, followed by hip joint. Now we are correlating osteoporosis with geriatric population, which means aging above 65 years of age. Then the risk of fall develops, and due to falls, majority of the geriatric population will land up into the fractures of spine and hip. That is the major concern. In the geriatric rehabilitation, we will learn it better way. If a coronal section has been taken from uh, bone, then if it is a long bone, the marrow will be inside and the cortex is the bone formation, which means the walls of the marrows are made up of bone. So if that that section is seen, the size of the diameter of uh, bone walls is increased or generally seen densed or thicker as compared to the one who is geriatric or older, elderly. So if we can see here, the porosity is increased and due to that the cavity gets increased. What is the pathophysiology? Okay, so we are going to have a pathophysiology of osteoporosis. Now, before we go for the pathophysiology, you should know what is the normal physiology behind formation and resorption. So there are osteoclasts, which are large, which are multinucleated. Those are the cells which are arrived from the monocytes. Their primary function is resorption. Osteoclast primary function is resorption, meaning bone eating, or we can say the bone damage, or we can say the bone resorption, which involves breaking down and removing the old or damaged bone tissues, right? Which are not taking part into the maintaining the rigidity, maintaining the structure of that bone. So osteoclast will remove those old tissues of bone. There they will attach to the bone surface, they will secrete some acid, and through enzyme they will dissolve the matrix of bone. This is a process which will be regulated by various factors, okay? Factors may involve hormones. Probably by this you might know that estrogen is very much responsible in females for the bone resorption. Also growth factors are also responsible. Cytokines are also responsible. So the activities of osteoclast, which will be controlled only by only if there is a balance between the resorption and formation. Now if we talk about the osteoblast, when we talk about the osteoblast, what happens is they are definitely called as bone resorption, bone formation cells. They will help in synthesize the new bone tissues and it deposit also. So basically they are stem cells, okay, and they will repair the bones. That is the in a very short way we can say that. Osteoblast, they will secrete a protein like structures which will contain collagen, okay, and it will subside on the matrix. It will subside on the damaged matrix of bone, like you can see it in the figure. The form of organic matrix, it is called as bone. They also regulate the mineralization of bone, which means depositing the calcium and phosphorus ions, right? Now, The osteoblast, they actually working in the coordination of the osteoclast. So you cannot say that osteoblasts are working independently and the osteoclasts are working independently. There will be a balance between each other, okay, in a normal condition. So this is called as a remodeling of bone, okay. This is called as a remodeling of bone. Now, when we talk about the osteoporosis, what is the pathophysiology of that? So basically, osteoporosis, it is influenced by, as we discussed earlier, it is affected by genetic. It also has some imposed on due to lifestyle changes and the hormonal imbalance. The traditional model of osteoporosis, which is focused on its endocrine mechanisms of the disease, the state. So we can say the osteoimmunology is a kind of a word which is keeping the pathophysiology in another researched level. So that is just for knowledge purpose that how the osteoporosis and osteoimmunology is affecting osteoporosis. Okay, which means it also has an impact on osteoclast and osteoblast activities. So let us not go to that way. It was just for a knowledge purpose that yes, osteoimmunology is one of the mechanism that is affecting the formation and resorption balance. Now, if we talk about hormonal, estrogen deficiency is also one of the factor for the bone loss. It is affecting the generally it affects indirectly through the release of cytokines. Now, the inflammation of the inflamed cytokines will be more in postmenopausal women. Now we need to have our attention on that. That yes, most of the postmenopausal women will be having a inflamed cytokines, and due to that, bone loss is increased, which means the activity of osteoclast gets increased. In addition to that, the inflamed cytokines is also found in elderlies. Okay, and that is also a cause of reduced bone density, that is bone loss, and then they will be more prone to get fracture. Okay, so this is the idea of osteoporosis and formation and resorption of um, bone. Okay, now bone is also, how does a bone get regenerated? Because of the stress on the bone. We all know that muscles are attached through the tendon to the bones. So as the human body moves around, the gravity impact, we are working against the gravity for most of our activities like walking, holding weight into our hands. So all this stress will impose on the bone, and that is why bone generation and bone resorption gets into the picture. Okay, so I will summarize this slide by that it involves the osteoporosis. It involves the complex process. We can say it as interplay of the bone tissue and the metabolism. Okay, and due to that, bone loss may occur. So basically, it's an activity between the osteoclast and osteoblast. Yeah. This image is explaining itself. In the first uppermost image, if we see bone absorption quantity of minerals should be similar to the bone resorption. bone formation. Bone absorption meaning here is resorption, and reformed, that means bone formation. So if those both of that quantity of minerals are same, then there will be no change in the pure quantity of bone mass. But if the bone resorption or bone absorption is increased compared to the bone formation, that means there is a bone loss. Now there are two types of osteoporosis: primary osteoporosis and secondary osteoporosis. Now what are the causes of primary osteoporosis? It runs into genetics, yes, it does. Along with that, postmenopausal women are prone to get primary osteoporosis, which means there is no any secondary cause. Okay, due to a primary disease, osteoporosis is not occurring, and that is why it is called as a primary osteoporosis. Okay, if a person is a prolonged bedridden, then also you get a osteoporosis. If you are having a habit of smoking, then chances of getting osteoporosis is higher. And if the elderly, again, it will be a bone resorption activity increased. Secondary causes that due to some disease or disorder, osteoporosis occurs. Okay, few examples here, like oncotic drugs, which means oncology drugs, drugs which are used for the carcinomas, use of steroids, blood or bone marrow disorders, like somebody is having a suppose bone cancer, okay, or a leukemia, blood cancer. Organ transplant may also stimulate the imbalance between the osteoblast and clast, multiple sclerosis, and so on. Fine. Now, what are the osteoporotic uh, causes and its effects, we can say, and how does it process? So, first here is type 1 and type 2 osteoporosis, and the second one is secondary, which means the first types are primary related. And how does it do? How does it do? If the menopausal is there, then it is predominantly in females. Obviously, 10 to 15 years of after the menopause, patient will be having a low estrogen. There will be a trabecular formation in the bone, if we know. So there will be a loss of that, and that will increase the bone loss. Where the type 2 is a senile, meaning age related. Okay. So basically it is after the elderly or at the age of 65 or 70 mostly, those individuals are prone to get osteoporosis in a type 2, that is senile one, that is age related, because there are multiple factors, okay, responsible. As we discussed earlier, aging is one of the factor, hormonal changes is there, then comes the calcium or vitamin D deficiencies, that means nutritional deficiency will be there, okay. There will be lifestyle changes, there will be restriction in activities, and the genetic factors also impose, okay. And due to that, cortical or a cortex type and a trabecular bone, there will be a decreased quantity on the ions into from that, okay. It is a non-accelerated bone loss, meaning there will be there will not be any type of increase during the process of bone loss. It will be a same quantity bone loss, or we can say there will be not any event impact on the acceleration. It will be an non-gradual one. The bone loss will occur at a steady rate because there is no any uh, incident factors responsible here. Okay, as we discussed, the factors are genetic, lifestyle, calcium deformation, which means nutritional steady decrease in nutrition, hormonal changes. The secondary one, it affects in both genders. Okay, and it can occur at any age because it is a secondary, which means due to some disease or disorders primarily, which is leading to osteoporosis secondary. That's why it is called as secondary. It can be result of a medical procedure, disease process, or a medical treatment. That means medical procedure. And due to that, cortical and trabecular bone will be having a decreased density. Now these are the risk factors. If we say it, if we started from risk factors of osteoporosis, then due to osteoporosis and the sorry, due to these type of things, you may get high risk, and also due to uh, uh, certain I would say symptoms of other system, you may also get chance to stimulate osteoporosis. Okay, current cigarette smoking, low body weight, alcoholism. Okay, these are the risk factors for the physical activities, right? Fragility. Now here I want to explain you the term fragility. When can you say you are a fragile or some patient is a fragile? Fragile is very much different from delicate. Fragility is a term which is mostly used in the term in mostly used for the geriatric population. A person is a fragile meaning those who are having multiple disorders or disease, and that is impacting their quality of life moderately. We can say that yes, that individual is fragile. Okay, so these are the risk factors. Access is the phonic that you can use. Access lead to osteoporosis. Okay, so most of it is covered: alcohol use, corticosteroids, calcium, estrogen, smoking, and sedentary lifestyle. Now, who are at risk? Those who are having nutritional deficiency, estrogen deficiency, genetical histories, okay, family histories. We are following the rule of first sibling. Certain drugs, endocrine disorders, these are responsible for osteoporosis. What can be a symptom of osteoporosis? Generally, osteoporosis is a silent disease, as we all know. It doesn't impose any symptom, but due to osteoporosis, if some secondary disease or disorder occurs, then yes, it may impose something. Okay, suppose a patient will have back pain, and back pain will be not only for because of the osteoporosis, but because of the some injury to the bony structure there, or the muscle weakness due to which there is an immobility, there is a possibility that there may be a muscle weakness, and due to that there will be a back pain. So it's a vice versa, but it generally it is not because of the osteoporosis. Okay, stoop posture is one of the it is, we cannot consider it as a whole symptom, but it's a accumulation of all the signs and symptoms, and that is a posture that a person may gain. Bone fractures will occur okay, because of the weakened bone. So next slide is deformities. The most common is Dogger's hump. So this is a kind of a deformity or a disorder of a spine in which there will be a kyphosis. This deformity is common in females. Mostly it occurs due to the anterior aspect of the vertebral bodies. The superior inferior surfaces gets degenerated, and due to that there will be a uh, prominent kyphosis from the thoracic vertebrae, and that will result into altered posture. This is how we can see here. You can see because of the excessive kyphosis, there will be a excessive lordosis, that is we are able to see, that is a compensation, so that along with that even there will be an anterior pelvic tilt that you are able to see, right? Loss of height, pain in the musculoskeletal system, shortness of breath, and hernia. Hernia will be of either any abdominal structures like herniation of the diaphragm, herniation of the colon, okay, umbilical herniation. So this all occurs due to the weakness of the muscle, so that the abdominal, if the abdominal cavity gets weakened, you will have hernia, right? So that may be one of the sign. Protuberant stomach, that is a belly like stomach. Stress incontinence. Incontinence meaning you are not able to hold the void of urine. You are not able to hold the urge of micturition. You are not able to hold and control the defecation. Okay. For say, as a person sneeze, he or she will be having a symptom like dribbling of urine. Okay. So that is called as a stress incontinence. Transparent skin, that means the skin becomes very thin. Kyphosis, as we already had discussed. So here if you see here, you see in the lumbar vertebrae, compared to lumbar vertebrae, the thoracic vertebrae gets more curvature, and that due to that there will be a flattening of lumbar, okay, and resulting in the kyphosis. You can also see here that in the abdominal region, it is because there is a kyphosis, the thoracic content will have a pressure on the abdominal content, and due to this, as a result of that, there will be a protuberance of the stomach, right? This is how the loss of height occurs. We all know that if there is a appropriate uh, erect spine, with appropriate erected spine, the height will be measured. This is how we categorize a person. This is how we set a criteria how the height of the person should be checked. If a person is having a kyphosis, automatically the overall height will be reduced, not only because of the posture but also with the curvature of spine angle. How to diagnose these things? This osteoporosis. Osteoporosis can be diagnosed with bone density test, okay, serum calcium checking, uh, neutron activation analysis, that is one of the sophisticated technique in which on a cellular level the calcium deposits will be checked. Bone biopsy meaning a chip of bone will be taken out, and then it will be sent for the culture, it will be sent for the further examination, and it will be studied into under a microscopes, and then it will suggest that what is the structure of bone, and then it can be diagnosed that whether it is osteoporotic bone or not. Okay. How can you diagnose? DEXA scan is one of the scan method in which porotic bones can be seen. X-ray, plain X-ray meaning a simple standard X-ray of bone. You will be able to see more of the uh, blackish area. That is, we call it as hypolucency, and less of the gray area. As we know, that bone is off-white color in nature in the X-ray. Okay, air will be seen as black. That is, lucency is gray. If it is more black, it is hypolucency, which means less gray. If it is more gray or more white, then it is called as hyperlucency. So this is about X-ray. In the CT scan, same. Ultrasound scan meaning so sonography. In that also you will be able to diagnose the osteoporosis. These are all the confirmatory diagnosis. DEXA is most commonly used. It is a gold standard method by World Health Organization. This is an imaging technique, so it's a non-invasive one, and mainly it is used to detect osteoporosis for the spine, hip, forearm, calcaneus, and other parts of the body. This is how we do the DEXA. Now this DEXA is similar to X-ray. The here in this machine also, X-rays will be emitted. The full form is dual energy X-ray absorptiometry. So this is a kind of a sophisticated X-ray in which there will be a more advanced technology to image to produce an image through X-rays. So bone mineral density score, as the green suggests the normal density. Okay, if the density score is less than 0, okay, that meaning it is going towards the minus. So if the density score is 0 towards -1, that means that you are in a lower normal range. If the score gets -1 towards 2, which means a person is considered as osteopenia, which means there is a less loss of calcium and phosphorus, iron from minerals from the bones. It's called as deficiency. If it is less than -2.5, then a person or a patient is diagnosed as osteoporotic. Now we talk about the plain X-ray. Second is this standard X-ray procedure. It will not be a confirmatory diagnosis from the X-rays imaging, but it will be supporting to the other confirmatory diagnosis like DEXA, CT scan, bone mineral density, right? So it will not be a confirm diagnosis which will be made through a plain X-ray procedures, but yes, any expert radiologist will be able to detect and suspect the signs of osteoporosis from the X-ray taken of the body part. Now, this X-ray will only be able to detect, meaning the imaging from the X-ray film which will show the bone as a light gray color, muscle as a dull gray, any metal white. So these imaging will be shown as much. If the bone is dense enough, then it will be a bright gray. Now, in the radiological terminology, we do not say black and white or gray. We say in terms of lucent, lucency. Gray means lucent, more gray, hyperlucent, less gray, which means more black, hypolucent. So in the radiological terminology, lucency is the word. So if the bone loss is more than 40%, then only you will be able to suspect or find the traces of osteoporosis. Now, as you can see here, in the normal X-ray, which is onto the left side, normal. Here, if you see the lumbar X-ray vertebrates shape, you will be able to detect an appropriate vertebral shape. There is no any type of a shape change here that we can say definitely. You see the borders of the vertebral column. All the borders of the vertebrates are homogeneous. Homogeneous meaning equal. Okay, there is an equal gap between each. Now, similarly, if you see from the other side on the right side image, which is here, if you see the shape of the vertebra is changed first. Between the vertebrates, the shape is altered, which means there is no any definite space between these two, right? Even that, can you see the borders? Now, in the border of vertebrate, this is the inferior border. In the border of a vertebrate, the border is more calcified, which means there is a sign of degeneration. Even the shape is more rectangular compared to the normal one, right? Plus, if you see here in the normal vertebrate, the density of bone, it is gray. Okay, gray meaning lucency, as we discussed earlier. Here, if you see any vertebrae, it looks like a hollow structure, which means inside the vertebral body, it is less gray, which means X-ray rays are able to penetrate the bone much easier way, and that is why it looks like that it is a less dense. And this is how a doctor suspect that compared to the normal, this might be an abnormal. Okay, still I am telling you that it is not a confirmatory through x-rays. We can suspect. Okay, always radiologist will write in a impression of comments that suspect of or a possibility of osteoporosis. Okay, and then the further diagnosis will be needed to confirm. This is a quantitative computed tomography, right? And as we all know, instead of one side of X-ray beam, this CT scan will emit X-ray from all 360 degrees. So whole of the limb can be scanned from all the side of the forearm or cylindrical shape, because the body is like a cylinder shape. So from all that cross sectional area can be scanned. Okay. Another is ultrasound. It cannot diagnose the osteoporosis, but it will diagnose it will be able to detect the amount of calcium and phosphorus into the bone. Now, larger body part cannot be scanned through this ultrasound. Only a smaller body parts like patella, forearm, okay, like this it will be able to detect the mineral quantity, and then again they will have to go for the bone mineral density test. Others are urinary secretion of hydroxyproline and calcium. Urine sample through urine culture, you will be able to detect that. It's a signage, okay? It's a one of the sign. Now again, these biochemical markers are not the confirmatory, but it is an addition to whatever the confirmatory diagnoses are. Plasma estrogen, you will be able to know the primary cause, what is happening, why is happening. Okay. Osteoclasin and alkaline phosphatase. All these parameters will be checked and the osteoporosis related diagnosis will be made. How to assess as a physiotherapist? How to assess such patients? Okay. What should we take? Personal information containing all the demographic data, along with that height of a person, weight of a person, race meaning not caste, race meaning your ethnicity, okay, which means are you an Indian? If you are an Indian, it will be a mixed population, okay. If you are an Australian, Canadian, you will come under the Caucasian population. So like this, there will be a race deferred, because as per the according to the race, the bone mineral density normative value will change, and that is why we as a therapist should know which racial differentiation will have which normative values. Okay, female athletes, if a female patient is there and that is an athlete, we should particularly put an interest to the assessment, because as an athlete she will be having a great stress on to the body parts, joints and bones. So you'll have to make a note to it that yes, what kind of activities this female athlete is going to have. Okay, so it will be helpful for us in planning out the training program. Along with that, it will be helpful for us what kind of test to be chosen, what kind of clinical test to be chosen for this particular population. Family history and other histories in the assessment is very important. As we all know that osteoporosis has a genetic cause also, in addition to the other factors. So family histories are important. We need to ask a family history, meaning whether your parents are having osteoporosis, whether your first sibling is having this kind of any sign or any diagnosis, whether they're your parents' first sibling. So here first sibling rule comes into a picture. Okay, so that runs in genetic. Other than that, other than first sibling, how many of the members are having it? That is also an important parameter. Personal history contain diet, nutrition related assessment. What is the diet of an individual? How is the sleep? Is there any addiction? Because Tobacco chewing, cigarette smoking also lead to washout of calcium phosphorus mineral from the body. If a patient is a female, if it is more than 50 years, at what stage menopause occurred, whether it is in a perimenopausal phase or not, which means whether is there any irregularities in the periods or menstrual cycle has been observed or it is still going on, whether the patient is postmenopausal, pain history, any kind of a joint pain which has not been relieved right now, that you are supposed to ask. Chest expansion, we should ask, we should measure with the help of each tape. There are three levels of chest expansion: axillary level, nipple level, and epiphisternal level. So these three levels will let us know what is the chest expansion. Let me tell you, the normal chest expansion value is 3 to 5 centimeters in a healthy adult. Is there any kind of a deformity in the spine? As we discussed, any kyphosis, scoliosis, lordosis, hyperlordosis, that should be checked. How is the lumbar flexion extension range of motion? That we should check. What are the strength parameters of the major muscle groups? Now this is a kind of a subjective examination. As the patient is having a complaint, the therapist will choose which muscle to check the strength. But in general, if there is any complaint of generalized weakness, generalized pain, then in that case we generally choose the major group of muscles. Okay, strength is very much different than endurance. We all know that. Balance is very important. Balance is not a diagnosis of osteoporosis, such that even the chest expansion is not a diagnosis of osteoporosis. None of the physical examination will directly point you to the osteoporosis, but these physical therapists will examine the patient so that any kind of a risk can be prevented, any kind of a prone to injury can be prevented, and in that direction a plan can be executed, plan of exercise therapy. Okay, so that is the main aim, and that is why we also need to check the balance. Why balance? If a balance is poor, risk of fall is more. Risk of fall is more if an osteoporotic patient is there. Fracture is the uppermost highest level of injury that you can get. Along with fracture, there are other consequences also. Suppose the fracture is displaced fracture, it can prick inside the viscera of the body and can cause further complication. Functional assessment. As a physiotherapist, we should also take a functional assessment. What is functional assessment? Functional assessment meaning you need to assess a patient functional levels, whether the patient is able to walk on a level surface, on an uneven surface, on a slopey surface, okay, whether the patient is able to carry out his or her basic adials and instrumental adials. We will talk more about the instrumental adials, but for now please learn about basic adials, basic activities of daily living, which means patient is able to bathe on her own or on his own, able to eat, able to dress up, and able to maintain the hygiene of the self. Along with that, whether the patient is able to carry out the small activities which are necessary for his or her ADLs. Okay. So this will be considered as functional assessment. Okay. How will you prevent the osteoporosis? As a physiotherapist, we will first, if we think about the exercises, then this is where we are lacking the complete scenario. You need to, in order to make this patient of osteoporosis gain the appropriate bone density and gain the, be able to prevent or stop the signs and progression of osteoporosis, then in that terms you need to take a holistic approach. So right from the cessation of smoking and tobacco, you should also give some advices related to the nutrition. For that, a physiotherapist should always refer to a nutritionist. Calcium, vitamin D is crucial for that. Weight bearing exercise is a major role because we all know osteoblast and osteoclast are being stimulated with weight bearing of any joint. So that will help in preventing the osteoporosis or limiting the osteoporosis. Reduce the alcohol consumption. Any risk factor which is particularly personalized or customized for you, which means suppose you are a worker of a in a traffic police, you are a traffic police officer. In that case, there are certain areas that you might be more prone to get uh, you might be more prone to get injuries despite of you having an osteoporosis. Medications, right? So all these things are necessary for the prevention. But if we think about the last slide, all the examination is not pointing towards only prevention but also towards limitation. Okay. What should be done? If you see here, calcium, D, vitamin, exercise, prevent falls, gain weight, and stop smoking. Gain weight meaning here is not the fat accumulation. Gaining weight meaning here is hypertrophy of the muscles and the bone mineral density is increased. That means lean body mass should be increased. How will you manage any osteoporotic? Management meaning secondary treatment. Osteoporosis is done, it is diagnosed, it is confirmed that a person is having a osteoporosis. What will you do next? There are medical treatments, physical therapy treatments. Now, daily calcium intake is already decided from right from the birth of the baby till older age. It has been suggested in IU, international units. Okay. Medical management, hormone replacement therapy, biphosphate intake, estrogen modulator treatment, and intake of calcium and vitamin D. What are the biphosphates? Alendronate, risendronate, and etendronate. These are the drugs which will inhibit the absorption, or we can say resorption capacity of the particular bone. Okay. So directly it will inhibit the osteoclast, and this is how if there is an activity which is normal or reduced of osteoblast, it can compete and it can have a maintain the balance with the osteoclast activities. So that would be a medical management. Now hormone replacement therapy, what they do? Generally it is because of the estrogen progesterone level imbalance, it is thought to have a more prone to get osteoporosis during this menopause period in females. So hormonal replacement therapy, introducing the hormones, that will be effective enough. Now, but hormonal therapy, it is not a safe therapy, I would say. Hormonal replacement therapy at one side will prevent or manage or limit the osteoporosis, but it has its own other side effects. Like, due to hormonal therapy, chances of breast cancer is increased. I have seen many patients whose histories are like this, that yes, for the they have gone for the IVF, they had taken a hormonal replacement therapy, and that was the reason that they had breast cancer lump on their breasts, and that's why they had come up with for the surgery purpose. So yes, hormonal therapy is having a more chances to get breast care related carcinomas. Along with that, embolism is one of the cause, one of the side effect I would say, and cardiovascular accidents. Okay. What can be done? In the milligram, you can take calcium and vitamin D in mentioned formulations. So 1000 to 1200 milligram, meaning 1 gram till 1.2 gram per day. You can take calcium and vitamin D. Generally nowadays calcium is also be available with vitamin D3, that will help produce the vitamin D in our body. Hip protectors, a known osteoporotic patient should wear hip protectors to prevent the fall related risk. Parathyroid hormone intake, introducing parathyroid hormone will also lead to prevention of osteoporosis and treatment. Physiotherapy management. Goal. What is the goal? Goal meaning whatever you want to do on a patient, finally these goals should be achieved. Now what is the goal here? Goal here is education. You are supposed to educate a patient so that the risk related to the osteoporosis, which means if it a fall is a will lead to an injury, any potential fatal accidents can be prevented with education. A person would understand their risk factors, person would be very much aware related to the supplements to be taken and do not skip. Individual or a patient will be able to understand if educated about the any addictions to be curbed, improve and maintain the bone density. How would you do that? As a physiotherapist, you are supposed to increase the bone density. How would you be able to do that without medication? We need to give them an appropriate age related, gender related exercise program, and that would lead to increase in the bone mineral density. Reduce the pain. Okay, reducing the pain meaning This is pain. Okay, there is a spelling mistake. Pain, reduce the pain. If at all, if any patient is having a pain in the pain might be a back pain might be a any joint pain particularly. So as a physiotherapist, you are supposed to reduce the pain or at least limit the pain. Okay, we are having some certain exercise manipulation, joint manipulation, we are having certain type of massage therapy, we are having certain types of electrical modalities. The main aim in that is to reduce pain. We as a physiotherapist need to be very much careful that any jerk, any vigorous movement, any vigorous activity will also lead to fracture or any potential injury in an osteoporotic patient. So, choosing a right treatment is always crucial. Suppose if a patient is osteoporotic and the age of the patient is more than 70 years, I would never give that patient any type of resistant exercises more than their 30% of one repetition maximum. So that is the precaution I have taken. It is fine if we gain the uh, uh, aim or we achieve the aim or goal of the therapy little late or delayed. It's fine for us. But we should never cause any kind of potential harm because of our treatment strategies. Next is to prevent the spinal deformities and fractures. Again, you should give the exercises and do's and don'ts advices. And the prevention of falls. For that, we should always treat the postural muscles. These are the educational related items that you can suggest. Weight bearing exercises, resistance exercise, aerobic exercises. These are the examples. You can see these are the examples of aerobic, stretching. We need to be very much careful while we are suggesting a stretching. Any end stretching should not be allowed. Any vigorous or high intensity stretching should be prevented or avoided. Aerobic exercise involving stretching. Avoid overstress is the key, not only in the osteoporotic treatment but also overall in physiotherapy. Overstress of the particular segment or the whole body is to be avoided. Always give warm up and cool down exercises pre and post exercise session. We should not only do the resistance exercises but also do aerobic along with resistance exercises. It is an evidence based exercise treatment strategy, and if we are doing it, there are two things which will be achieved. Not only your body is having a weight bearing exercises but also your respiratory system and cardiovascular system also getting endured training. Endurance training is been given to the systems, and that is why both of that crucial vital systems, cardio and respiratory systems, will be able to supply the appropriate nutrition to the targeted tissues. Other considerations: site specificity, meaning your exercise plan should be such that whichever the problematic area in the body is there, you should first target on that. Second is progressive overload. You should carefully plan the intensities that you are going to progress. Individual differences. It doesn't mean that you have prepared for some patient, you can apply to the next coming patients. No, it is not like that. You in every exercise assessment and uh, treatment plan should be tailor made. Tailor made meaning as per the individual's needs and as per the individual's disorders and deformities. Reversibility, we should also take it into consideration. Reversibility meaning once you stop doing that exercise or stop doing that any protocol, whatever you have achieved till now will come to zero. That should be understood. Frequency and duration. What should be the frequency of exercises? The total duration should be 30 minutes. Okay, weekly 30 minutes. Mind you here, okay, it is not then like other exercises. Okay, it should be done 3 days a week. Total should be 30 minutes. Increasing the frequency later on, progression should be 5 to 7 days if appropriate. Pain and fracture, these are the consideration that you are supposed to understood. Age related exercises should be planned. What can be given into reducing pain? You can give hydrotherapy. Cognitive and behavioral strategy meaning you can give any kind of a task oriented exercises that will help reducing or limiting the pain. Relaxation therapies like Jacobson relaxation, Laura Michel relaxations. Electrical modalities like transcutaneous electrical nervous stimulations, therapeutic ultrasounds, and shortwave diathermy. Okay, these are the treatment strategies to reduce pain. Postural corrections to prevent deformity. How to lift an object from which is in on the floor. That education you can give. What is here? It is written strapping act as a proprioceptive device to stimulate the extension. One example for this is, suppose a patient is tend to have a stoop posture, which means he or she will be having a more rounded shoulders and flexion from the back, lower back, lumbar area. If this is the case, what is main needed to correct a posture? We will not be there in their daily living life as a physiotherapist. So patient will have to learn how to correct their posture. For that, one proprioceptive device. It is a sophisticated terms. In a layman term, we can tell, we can simply stick maybe adhesive tape on the back of the patient, lower back area, middle side, or both the paraspinal side. Whenever the patient will have a tendency to flex or bend down, this simple adhesive tape will remind them that yes, I am not supposed to do a particular movement and I am supposed to sit or stand in a particular posture. Because of the stretching sensation which will be received from because of the adhesive tape, patient will be continuously reminded. That is how you can gain a postural correction. There are intrinsic factor, extrinsic factor. Extrinsic factor meaning surfaces, slippery surfaces, or odd surfaces, okay, not even surfaces, like such clothing of the patient which will restrict the joint range of motions. Intrinsic factors are weakness of the musculoskeletal system, Okay, loss of coordination or weak coordination. Okay, loss of sensation, right? Certain medication that you have taken, suppose any medication which will cause lightheadedness, or which will cause blurry vision, or which will cause kind of sedative drugs, that will also cause falls. So these are the treatments for the osteoporotic patient. We had learned first the understanding of osteoporosis by pathophysiology of the same. We understood the normal physiology of the osteoblast and osteoclast. Then we understood the symptoms. Then what are the examination points that a physiotherapist should take care, medical management and physiotherapy management. The term management meaning you are managing the disease or disorders. The term treatment meaning you are curing the disease or disorders. In certain kind of a disease or disorders, a physiotherapist will have treatment, but in some diseases or disorders, a physiotherapist will be able to only manage a disease or a disorder. So this meaning is giving us a huge understanding of a subject, that whether we should choose a treatment strategy in which cases, and whether we should choose a management strategies. Unless and until you cure a cause of pain, you will never be able to treat the disease. So if a patient is having a joint pain, you can just manage a symptom of a pain. You cannot treat a symptom of a pain. Okay. So this is a difference between treatment and management. These are the references that you can check, you can read. The presentation is just for your understanding purpose. It is not for your exam purpose. You are supposed to read it from the books which are given in this slide. Along with that, there are books which are referred as a reference book given in your syllabus, subject syllabus. Refer that. If that kind of any query, we can discuss it later. I hope there will be questions, and I will be glad if I can receive some questions from your side. Whenever we will be meeting, we will be having a discussion on your queries. Thank you all.